Hi, my name is Maria, your massage therapist. On this video, you will learn about the 5 basic strokes of Swedish massage. First stroke, effleurage, French word effleurer, which means to glide or slide. Description: it is a gliding movement repeatedly done following the contours of the body using palm, knuckles, fingertips, and forearms. Rationale: it is used to introduce touch, apply lubricant, and as transition stroke. Benefits: it relaxes the client, calm the nervous system, when done slowly, especially on the part that is painful. First variation, one-handed. Sub-variations: number 1, raking 2 fingers together or apart with pressure. Number 2, ironing a deep pressure using palm, knuckle, and forearm. Number 3, circular gliding on the skin in circular motion. Second variation, two-handed. Sub-variations: number 1, hands gliding simultaneously on the skin. Number 2, heart shape, long deep strokes hands, while using 2 hands in a heart-shape motion. Number 3, circular gliding on the skin in circular motion. Third variation, alternating, raking using 2 hands alternating. Fourth variation, nerve strokes. Nerve strokes, a feather-like strokes, from proximal to distal. Second stroke of Swedish massage. Petrissage, French word pétrir, which means to knead. Description: it is a lifting, squeezing, and deep pressing of tissues. Rationale: the hands in C formation while performing the strokes. Benefits: working out metabolic waste and releases muscle stiffness. Variations of petrissage: first, clamp squeezing done on trapezius. Second, two-handed. Sub-variations: A, hands praying done on the arms, fingers interlaced while the palm is squeezing out the tissues. B, ocean wave palm gliding in opposite directions. Third variation, alternating hands, grasp and release hands. Fourth variation, fulling, hands separating and lifting tissues upward direction. Fifth variation, skin rolling, lifting tissues on superfascia with no downward force is involved. Third basic stroke, friction. Description: from the word frictio, known as rubbing, sliding hands open palm, fingers, knuckles back and forth over the tissue layers, usually dry or with oil. Rationale: often used on areas that has blocked muscles. Benefits: loosen stiffness and free hard tissues. Variations of friction: first, superfascial warming. Sub-variation: A, sewing done near the scapula. Second, rolling, holding hands together while rubbing from distal to proximal direction. Third variation, ringing, firmly holds the hand while doing the twisting in opposite directions. Fourth, cross fiber, thumb rubbing in opposite directions and perpendicular to the muscles fibers in moderate to heavy pressure. Fifth variation, chucking, in between the fingers in directions of the muscles and tendons. Thumbs and fingers move back and forth. Sixth variation, circular, small circular movements that glides over the skin and underlying tissues. Fourth basic stroke, tapotement. Description: a French word tapote or percussion, a repeated striking movement simultaneously using the ulnar edge of the hands, fingertips, open palm, cup palm, loose fist. Rationale: apply directly on the skin or while draped while avoiding the liver and kidneys area. Benefits: it stimulates nerve endings and it is the most sedative and promotes blood flow. One street variation, tapping, using fingertips of one hand or both hands of a various speed. Sub-variations of tapping: A, punctuation known as hard tap. B, pulsing alternate deep light tap. C, raindrops using light fingertips tapping over the skin at different times. Second variation of tapotement, pinchment, done by grasping quickly at the point of striking. Sub-variation: fluking, skin is lifted fully and slowly at the point of striking. Third variation of tapotement, chopping, using the ulnar edge of the hands with fingertips relax. Sub-variation: quacking, using the last 3 fingers with sound. When done along the muscle, the benefit is it relaxes. When done across, it has a micro-contraction effect. Fourth variation of tapotement, cupping, cup hands, losing chest congestion on the chest cavity, may induce coughing, Fifth variation of tapotement. Pulping. Loose fist with moderate strength. Sub-variation. Wrapping when applied palm down. Sixth variation of tapotement. Clapping. Using palm striking simultaneously. Seventh variation. Diffuse. Lay palmar down surface skin and diffuse force. Move across the surface. Fifth basic stroke of Swedish massage. Vibration. Description. Comes from the Latin word vibrio, also known as shaking. 1. Rapid shaking. 2. Trembling using fingertips and slide along full back with effleurage. 3. Rocking applied with fingertips of one hand while other is catching. Rationale. Performs vibration correctly needs coordination and practice. Benefits. It moves peristaltic movement and remove gas at the intestinal tract. First variation of vibration, fine vibration. Fingertips trembling on the skin, fingers and wrist gliding along. 2. End variation, jostling, rigorously shaking along back and forth. 3. Ard variation, coarse, grasping from the most proximal to the distal. Thanks for watching. Please subscribe to this channel.